Welcome back. We are now in part 2 of our series about CANS. So treatment planning, all things CANS, part 2, CANS in Idaho, a parent's guide to understanding this powerful tool. So we are once again joined by Dr. Fernando and also Amy Marie. Trisha is still having technical issues, can't join us, but we are excited that we are going to be able to have this conversation. As always, questions in the chat, and the recording will be at idahoparentnetwork.org when we are done. So today, in this session specifically, we are going to talk about how can families make the most of their CANS experience. What does it look like when the CANS is used for treatment planning, and how is a CANS updated? So we're excited to get through these things, and we are going to quickly, for those who did not join us in the first session, explain what the CANS is so we have a base knowledge. Dr. Fernando?
Hi, everybody. Welcome back. And for those of you who are just joining us, we're glad you're with us. So you have the description of what the CANS is on the slide. I just want to highlight a couple things. First of all, the CANS does support decision making, which we're going to talk about more in just a second. And it helps us monitor outcomes, which is one of the main reasons you all are interested in the CANS. This tool is designed to organize information to tell the story of your child and your family. And as you tell that story, the CANS is used to identify those needs and strengths. Those are the themes of what's going on in your lives. And so by understanding these themes, we as the professionals are able to work with you to identify ways to provide you support and help you change things so that you can enjoy your family, enjoy your children, and be happy, healthy, and thrive, as John Lyons likes to say. All right, so we're going to first start by talking about how can families make the most of their CANS experience. Some tips and tricks to keep your CANS on track. So let's talk about how to leverage the CANS. And I'm going to ask Laura to prioritize these questions for us, since she's closer to them than I am. And I'll try to provide some best practice kind of thinking about it, and the parents can help you understand what worked for them.
You know, these are probably the questions that Amy and I field the most as part of the parent network. This is the stuff that we get from families. And you brought up Dr. Lyons, who, for those who are not aware of how he interacts with the CANS, this is kind of his baby. I mean, he shared the baby, but this is his baby, and he does a lot of training on this. And anyone who is CANS certified has probably run into Dr. Lyons' face, at least in training videos. I had a CANS experience in a different state where they actually did give me the rubric, and they gave me a 0, 1, 2, 3, and they told me what each one would mean. And they said, no description, no explanation. It was like those photo challenges on Facebook, 10 pictures of your senior, no explanations, go, right? And he said, I don't want any information, just give me a number. We have to go fast. This is a long thing and it's going to take us a while. No talking, just numbers. And I said, you're doing a CANS? And he said, yes. And I said, that's not how a CANS is done. And he said, well, I'm CANS certified. And I said, well, I know Dr. Lyon said this is a conversation. And he said, Doctor who? And I went, ugh. And my sister, who was part of the process with us, texted me. And so I would see it without her having to say it. This man is never going to figure it out. Just give him a number and let's go. And I remember being very frustrated because this person didn't know me. So I think we talked about this a little bit in the last session, but what do I do if the CANS is given to my child as a checklist? And I mean, you pointed out before that some people like checklists. That's an okay thing. But if you are trying to tell your story and someone says, give me a 1, 0, 1, 2, 3.
Yep.
It's a little insulting.
Yeah, it is. I mean, young people say, I feel like, I'm at the Olympics and you're giving me a score, right? And I didn't come here to be rated on who I am. So when I train people who are working with parents like you, I tell them we do not use numbers when we're talking to parents and young people. We don't need to use numbers. Why does the CANS have numbers? The numbers are used to take many, many stories of many, many children and combine them together so that we can understand what groups of kids look like. We can understand what's happening in the state of Idaho, for example, or in each of the 7 regions and how they're different and how they're alike. But when we're working one-on-one with people, we really don't want to, especially at the beginning, to use numbers. Now, later on, as the family and the young person is more comfortable with using the shorthand of the numbers, sure, let's use the numbers. But at the beginning, they're gonna feel bad about it because they're feeling judged. So it's really important to keep talking to people about what's going on with people. And so if someone, go ahead.
I would just say if my provider's like, well, I only want a 0, 1, 2, 3, I would probably, because I'm cheeky, I'd probably say, you know what, you're the expert. So I'm going to tell you what's going on and you figure that out.
Or you could say, you know what, I'd rather tell you what's happening, right? This is a nice way of saying what you're going to say, right? I would rather tell you what's happening and then you can track it however you need to track it, numbers or whatever.
They say that's so much nicer. See, you're a nicer person than I am today. This is another one. What do I do if a provider says they don't have time for a CANS or to do a full CANS? I actually was in a meeting with a provider who owned an agency and bragged that no one in his agency had ever spent more than 15 minutes on a CANS beginning to end with a brand new family that they'd never met before. I may or may not have let him know how grateful I was to know not to go to his agency.
Right. And that's the first thing that popped into my head. But I also know that sometimes we don't have a choice about where we start our journey with getting help for our children. And sure. So, Amy talked about this earlier, right? When they said, oh, we were going to do this in 45 minutes. She's like, no, we cannot do this in 45 minutes. If they insist, here's what I would do. I would meet with them, just you, and not subject your child to that super short thing. And once they realize, hey, you didn't bring your child, I'm like, no, this is not going to happen in 15 minutes for my child. Mm-hmm. I can talk to you about what's going on in the family and with me, but not my child. We need more time. And keep pushing that issue. They should be able to get it, right? And if they don't, then see if you can, you are entitled to help. And if you can't get help from the first person you come to, then try to find somebody else and tell someone what didn't work, right? Well, I know for a fact that Medicaid has a complaint section. So you need to tell them that this didn't work and this is why. And as much as you can, like for me, I might have to write it down a few times to make it so that Medicaid can read it, not dismiss it because I'm pissed. Right. So,
well, there are a couple of ways to do it. I mean, if you have a good relationship with the provider agency, you can always ask to talk to a supervisor or the owner of the agency if that is something that you feel comfortable doing. If not, Optum has a direct line you can contact because they are responsible for the provider network in Idaho currently that does that. But even if that's not where you're comfortable or you're not sure that's what to do, if you go to yes.idaho.gov, there is a concern and complaint contact section, and you can write out what you're concerned about, and then they will make sure it gets to the right people to address the concern. And actually, that might be our preference because that allows the state to track what concerns are coming up across the state in a holistic fashion so that they can figure out if it's regional or if it's, one provider or one family, or, they can figure out where the problem's coming from and solve it at the level it needs to be solved. So that would be what I would say. And this one, Amy, I think you can speak to. What do I do if someone who doesn't know my family is assigned to do my CANS?
Well, this has happened quite a few times, and luckily, because I have been involved with mental health advocacy work and understand the way that it's supposed to actually be done, I can dig my feet in and just keep reminding them, no, this is not how it works. This is not that's not the way it's designed. And, they'll come back with, okay. And then the next person calls, and then I'm like, okay, let's talk with the clinical director. Okay, that didn't work. Okay, well, I happen to know the owner. He's my neighbor. Let's talk to him. And it still doesn't work. And then of course I call Laura and be like, okay, Laura, what do I do? And I'm one of those parents that really holds the last resort in my mind is to file a complaint. I don't like doing that. I don't want to seem like I'm a complainer. I don't want to call people out, especially if it can be taken care of, on a friendly basis. That's great, because I don't want to get anybody in trouble. I just want the system to work the way it's supposed to work and the way it's designed. And so she always nudges me and reminds me, it's not just about you. It's about the families that follow you, and it's the families that don't know how it's really supposed to be. And so, yes, it's happened quite a few times with my family. And one of the times, because I was frustrated after getting call after call, I mean, like, it was like 6 months of them trying to do this. I finally was just like, fine, let's just hurry up. Let's just get it done, get it out of the way. And I definitely regretted that experience, because I felt very vulnerable. I felt like, here I am telling you the worst of the worst that's been going on with my family and multi-system involvement. And now I'm worried that you are, what are you thinking and what are you doing and what's going to happen? Is this going to trigger an investigation? And so I was able to go back to the therapist and say, see, this is why. This is, not only is this not good for my child, it is not good for me as a parent. And so just keep plugging away and keep reminding them that that's the way it's supposed to be done. And if you need to go to a different agency, then so be it. Unfortunately, we've got a lot of areas in the state of Idaho that are frontier, and you don't get to choose. If you're in an area that you have more providers to choose from, go ahead and let them know why you are leaving their agency. And don't be afraid to help parents along the way. I mean, it's not like I'm going to get on social media and blast a certain provider, but when parents are reaching out and asking, I'll tell them, hey, this is the experience that I had at this provider's, and this is a different experience I had with another place. And you may consider choosing a provider over one based upon what's happened with other parents.
And I think it's important to know that the first time you do a CANS, you may be meeting your therapist for the first time. It may be the first time you're establishing a relationship, and that may be what they're doing when they first meet you.
Right.
I think Amy and I are referring more to the CANS updates. And sometimes we will find that they'll ask someone who doesn't know you to do a quick update.
Right.
and that's not really what updates are. So Dr. Fernando, could you talk to, first of all, what is an update supposed to be? And if we get randomly bounced to what it feels like is someone who's just checking a box to make sure that they can, I've actually heard, well, we need to update the CANS so we can bill insurance. The CANS isn't about you.
Or the therapist doesn't understand how to do the CANS very well. And so that's why we've assigned one person in our office. Or we want to make it consistent. I've heard all the reasons why they do it and why it works for them.
Yeah, I'm happy to talk about this. We do have a whole section on it. Updates are really to help us understand if what we're doing is working, right? That's one. The other reason to do an update is because we need to change something on the plan because something's happened. Right? So we need to do updates. And when we get to that update section, I have a little guided imagery that we're going to do to help you understand what your update's supposed to feel like.
Yay!
Okay. So the update's really important. And the CANS in particular makes updates really easy, but you do have to meet with the people who know you.
So I think it's okay for families to just say, I'm going to wait till we have a chance to talk to the person who knows me. We can address it in our next session.
Yep. And that's what I've done.
That's right.
And so, okay, so what do I do when I can't agree with the provider on the CANS narrative? And so for the people who haven't ever actually seen a CANS in Idaho, not only are different areas rated on the back end as kind of a keeping track of what we've, where we are score, but there's also a section for them to write in what's going on, give some details, give some explanation. And when you get a copy of your CANS before it's finalized, or even after it's finalized, you will see that little section where they have written in information. Before it is finalized, they can change it. And if you don't agree with it, then that's the time for you to have a conversation about it, because that information will be shared with other providers, hopefully, and to collaboratively team and treatment plan. So what do you do when you don't agree on the narrative? So it's a little personal story, not a CANS, but the first time I had a therapist actually show me the treatment plan. You would have thought it would happen a lot sooner, but they actually showed it to me. It said that my diagnosis was generalized anxiety disorder and that they were going to do the following things for it. No one told me that until I saw it on this piece of paper. And I saw this general anxiety disorder and I went, like, and ironically caused me a lot of anxiety because I was like, where did this come from? I thought I had come in to deal with this other thing. And this is what they had written down as the thing to tackle. And it was on this document that they'd already signed and felt really official, and it was going to get filed in some magical place. And I felt like you needed to like walk me through this before you handed it to me. But more importantly, who's going to see this and where does it go? And, you know, do I have issues with anxiety? I think anyone who's met me will know that that is an accurate thing. And no one on the planet would have been surprised except for me in that moment. But it really, like, it threw me. And so when we did our first CANS and I saw the narrative section, I have to tell you, because of that first experience, I looked at it with eagle eyes. Like, is there anything here that doesn't feel like it's our story? And if there was, I asked them to say, can you explain this? And I did say, could we say it this way instead? Because that feels like it reflects our story better. And sometimes they're like, no, because this has clinical meaning, or no, because of this. But most of the time it was yes. But what are we supposed to do? That's what I did. What are we supposed to do?
So Laura, we got a question, and it's an important question because I have run into this and we know other parents have. What do you do when you can't seem to get a copy of your child's CANS, even from the initial assessment, to enter yes?
Which in other means you don't know if you agree with the narrative. Procedurally, you say, I need a copy of the CANS. And if they say, well, we need you to fill out a release of information.
And you already have.
First of all, it's your information. So I would smile and nod and say, but it's mine. Please send it to me. And if they say release of information, you could say, I'll be happy to fill out whatever you need for the other providers, but I get a copy right now. And releases of information are important for your other providers, by the way. But for you, I would stand firm on this. And in fact, I tell families to make it a practice when they've actually done a CANS to ask at the end of that meeting, when will I get a copy before you finalize? How should I expect it? Are you going to mail it, email it, carrier pigeon? How is it arriving at my house? And when should I follow up with you if I haven't seen it?
Well, in the beginning of yes, when it came out back in 2018, I mean, Laura and I, we were one of the first parents to go through the process. And as time went along, you know, you get different assessors. And when I asked that question at the end, okay, now when will I be getting my copy? You know, will you be able to email it to me later today or tomorrow? And they're just dumbfounded, like, what? You want a copy? I don't know if I can do that. I'm like, of course you can, and you will. Like, this is our information. We need to make sure it's accurate.
And I think the key point is before you finalize it.
Right.
So, Dr. Fernanda, how would you tackle this?
I think you guys have the perfect answer to this question. Let me give you some backstory. And it's not to give people an excuse, but it just tells you how crazy the world is. So when clinicians fill out paperwork for you, it's documentation that they don't think is yours the minute they start filling it out. And then some of us were trained that you know, what you write in clients' charts, they may not understand, so you shouldn't give it to them. You should, in fact, spend time talking about why they need it when they ask for it, which is bonkers. It's just bonkers. This is your story. You bothered to share it with them, and it's being captured in a document that's intended to be shared with other people to help you not to defame you or make something, spread rumors about it, to help you, right? So for them not to share it back, it's like, wait, I just told you my story, so can I have it back? It's a little nuts. So I think the things that you guys have talked about are perfect. Just know that there's this crazy stuff happening in the background with people and why, so if you get caught into, well, let's talk about why you want to see your document, you're now in crazy land. And you just have to say, this is my story. You've captured it on this tool. I would really like to have it back so that when we work on my plan, I'm prepared.
Oh, I like that. So that when we work on my plan, I'm prepared. So, and I think it's important that we talk about the narrative and before and after they finalize it. So the way that the system in Idaho works is when they finalize it, they really can't change it. They can update it, but that document itself is kind of now a fixed point. And they can update it and it can be changed with an update. But before it's finalized, they can go through and they can modify. So for example, if they didn't catch the fact that you, your story was big and complicated and they just missed a piece when they were inputting it into the system, everyone's human. They say, oh, let's make sure we add this. That was kind of important. Or, you said I have 5 kids, but I really have 2 or I have 12, whatever it is, you can make sure that it's accurate before it is finalized. But if they don't agree on the narrative, what do we do there?
Yeah, I think this and the what do I do when I don't agree on the action items what I'm going to say fits for both. I think it's okay to have differences of opinion. And it's okay to be in different places because sometimes you don't agree with the clinician. Sometimes the family doesn't agree amongst themselves, right? Like there's all different scenarios of people not agreeing, and that's okay. However, and I would like, if I was in the family, I would like my disagreement to be documented. I don't agree. Here's where I think things are, and here's why. And I know for parents and young people, it's really important that they're being taken seriously. So I write those things down, right? Here's an area where we're not quite all on the same page. Johnny thinks this, mom thinks this, dad thinks this, and I think this, right? The bottom line is the goal of the CANS is to help us figure out where people need support. So as a clinician, I always go back to that. Okay, we all don't agree. Here's what we all wrote. That's great. What are we going to do about this? Is this something that you all think you need help with? Right? Or not? Because that's the point of it. It's not about the number. It's about, do you need help with this? Right?
Well, so and I love the narrative being used to identify disagreements because that's part of the narrative. Right. it really does help flesh out some of the other responses given. And so, there are many times that, my son would have said, yeah, that's not that big of a deal. And I'm like, fire on our head, big deal.
Yeah.
and so where does the score fit? When they're ranking that on the back end for data collection and they're looking at how high the level of need is.
Yeah.
I think sometimes is my son doesn't see the impact bigger than himself.
Right.
So when I'm saying this is the impact to us as a family, it's a very big deal. And he's like, yeah, I got it. And we're like, no, you don't got it.
Right.
That is, I like the ability to use the narrative to add those different perspectives when we're not where they need to be. So I think this leads into this question. I like this. What can I do if multiple providers want to do their own CANs? And I don't mean like updates later. I mean, oh, I can't accept someone else's CANs. I have to do my own. And I think you kind of spoke to this last hour, but I'd like everyone in the back to hear it again.
Yeah.
That's not what Medicaid said, or that's not what Optum said. So why don't you read?
One child, one CANs.
Yeah, let me give the backstory to this, right? The reason is that we need to, if you get referred to another provider for something different, let's say you have a young person who is seeing me for individual therapy, but needs to go to a DBT group, right? To help with their kind of tantrums as adolescents and aggression and not getting along. They need ways to figure out how to self-soothe and calm themselves down. And this group might be good. So they go over there, and that group therapist wants to do an entirely new CANS, right? That is because our system is set up not as a person-centered system, but as a program-centered system. If it was person-centered, a person would enter the system, all the information would be taken from the person and shared with everybody. But it's program-centered. So every time you get sent to a new program, they open something, and for them, you don't exist. They have to start from scratch. And they're paid for that, right? That's why they insist on doing their own CANs. So I would insist that you tell them, I have a CANs, and I have a great person you can talk to that'll cut down the amount of time you need to spend to understand who I am. And then we can talk about why we've been referred to you and give you that information. Like, this will help you with your workflow.
And I think that's also remembering the ROIs, the releases of information, making sure you have one signed. That means telling your first provider they need to provide you either a hard copy or add that provider, push it to the other providers to take a peek. There's many options on how they can get it, but
Right.
So what do parents do when that process takes months?
Well, here's the other thing I would suggest you do. You go back to your individual, to me, right? You say, April, Johnny got referred to this DBT group. I need you to contact this person to cut down all, having to do another CANS. And I need you to do it right away because they need this group right away. So get the providers to work for you.
And if they don't, I hate to have to keep reminding everyone, yes.idaho.gov concern and complaint process. If nothing else, to help explain to the system that we've got a problem. I mean, I would honestly talk to your provider first. That is obviously the first thing you do. If you're not getting the traction you need and your kid is not having access to treatment unless you redo assessments you've already done, then that would be someplace to help the system improve. We want the system to improve. And I don't think providers are doing this because they think it's nefariously fun. I think it's because they have been told that they believe that it needs to happen. So I think, let's see, have we hit everything on? I think we've hit everything. We'll talk a little bit more about action items when we get to treatment planning. So I think we are, we've hit what we need to do. So let's go into our next one.
So our next thing we're going to talk about is, what does it look like when the CANS is used for treatment planning? So I mentioned earlier that the CANS is used to support decision making. We talked previously about decision making as one way of doing decision making is the level of care determination. Treatment planning is another decision making tactic that we use the CANS for. And I have to say that at a very basic level, if the CANS is not being used for treatment planning, what is the point? There's no point to it's a waste of time. So you got to use it might help for people to tell their story and feel engaged. But if the CANS information is not used beyond that, then they're missing a huge opportunity to be able to use, as this talk is called, the power of the tool, right? So it's really important that the CANS be done in a way that engages all of you in the process. So what comes out at the end is a CANS that reflects your story of what your family's going through right now.
Well, which means you kind of need to have a copy. When you pointed out moments ago that, saying, hey, I need a copy because I want to be prepared for treatment planning, knowing what things show up in the CANS as we need urgent action, or we just need to, we need action, or we need action right now, big deal. As a parent, you need to know what those things look like. And if someone hands you a treatment goal and you don't know where it came from, I think I would say that I've had some great providers for my kids, but very few of them actually asked me what they thought we needed to start with. I was told what services they would be doing that they do at their agency.
Right. Right. And that's, it's understandable, but again, that's provider centered, not person centered. Right? And so sometimes, and the CANS forces people to see the whole of the person, right?
Mhm.
And that's sometimes hard for people to understand when they're first using the CANS. Like, why do I need to know all that? There's no way I can help them with that. It's like, well, you're not the only person in the universe. There are other people who can help them with that. And you need to work with that person, by the way, so they understand everything that you're doing so that you guys can coordinate care, right? So it's really important that you do understand that CANS. You agree enough with it to be able to say, okay, I want to see where this is going to go on the treatment plan and how. And by the way, the treatment planning on the CANS, they need to know who you are as a family, because generic interventions will not work, right? They need to have interventions that work for you and your family.
Well, and I've actually heard someone say that there's nothing more to treatment planning than saying you'll work with a therapist, period. And I'm like, like that's what mental health care is you'll have a therapist, done, like nothing bigger than that. And it makes me twitch, it makes me, a little upset. But I think that there is still this misconception outside of the mental health world that a therapist is the beginning and end of all mental health care, and that a single therapist has all the things, that does all the things, that accomplishes all the things. And especially if you are a child, a family with a child with a dual diagnosis, you've got, for example, developmental disability services. Very frequently, you'll see DD plans that say, and a mental health therapist, period. Like that's the mental health goal.
Yeah, which kind of makes sense, right? That's all they're responsible for, is making sure you get a referral to them. And then the
Right.
mental health person actually fleshes it out. Now, if they were to have a coordinated CANS plan, the goals, the outcomes that we want on the CANS don't always look like your typical mental health goals, right? Because the outcome isn't to reduce the symptom. The outcome is to be better engaged in, family activities, or to be able to, go out on a date, or to be able to sit in class for a whole period and not be disruptive, right? That doesn't look like a typical mental health
No,
goal.
which means that sometimes it might be an occupational therapist who is
That's
going
right.
to address that, or maybe a speech therapist, or maybe, I mean, you are so many things that are beyond typical mental health
Right.
that, I say typical, that might be appropriate. I mean, my kiddo had, struggled with, wanting to shower and bathe beyond normal teenage, aversion to water. And for him, that meant, skills building was really, really an important part of his mental health plan, because he was noticing he didn't have a lot of friends. And we would joke, if they could smell you before they can see you, we're going to have a problem. And so, his plan looked a lot about personal care to have him ready for the next set of skills. And so I think that when you look at the CANs, those things become so much more obvious when you pick. And I think for us, it was picking a goal that my kid cared about. And I joke that if your goal sounds like an IEP goal, it's probably not person-centered. My child will bathe 3 out of 5 out of non-consecutive samples as measured by a sniff test. I mean, that's not a person-centered goal.
Right.
My kid will interact in groups where he develops friendships with people who enjoy similar hobbies,
Right.
right?
So,
And bathing is part of that.
yeah. So this is an area actually where you should insist on really understanding what they mean in their plan, because they're often required to write those kinds of goals, right? The SMART goal, where they're identifying behaviorally what it's going to look like, and they usually are counting behaviors.
Right,
And
measurable.
exactly. That's what they think measurable is. That's not the only way to think about measurable, by the way. And so you need to spend the time to say, I don't understand how this is good. This means this, right? I don't get it. And if I don't get it, my child won't get it. So let's sit down and figure this out in a way that makes sense to us. And then you can write whatever you need to, pass your quality assurance person. But I need to understand this so that I can help my child implement these interventions.
It was a lot different when we were implementing, saying, hey, bud, jump in the shower, because we're heading off to spend time with some people that you might really enjoy hanging out with. Oh, as opposed to jump in the shower because we have a 3 out of 5 goal that we need to meet.
Right.
He didn't care. He
Right.
absolutely did not care. And I think it's okay to have, I don't know, like levels of goals and then action items. Like, we're going to make friends. So maybe the therapy team, the mental health therapy team, is working on the anxiety of meeting new people. And the skills building is working on our hygiene. And, the person who's out with him in the community specifically is working on, eye contact in real life, or, like we've each
Social
taken
cues and interaction. Healthy
so
boundaries.
so each provider might have a different sub goal that they are reaching under the person goal at the top. But we as a family care about this and what each of you are going to do to get to this.
Right.
I do not care how you measure it for insurance.
Right. Exactly. And the cans can be really helpful in that if people can break away from the routine ways that they write plans. Right? And so this is actually one of the hardest things that we do in teaching people how to use the cans, is how to write plans that make sense. And they always hate it because it's so different from the way they write plans for Medicaid. Even though we make sure that it meets the guidelines of Medicaid, but it's just different. It's just a very different way of thinking about it, because decreasing symptoms typically does not always result in the changes that you want as parents, right? All right. I don't know if there's something in here we haven't talked about yet in the questions.
How do you collaborate around the youth's desires? So like I mentioned,
Yeah.
he wanted friends, but
Yeah.
I've had parents say to me, well, my kid is nonverbal. How do I know what it is they want? Or my kid wouldn't talk to me if I was the last person on earth right now. How do I know what they want? Or what if what they want is ridiculous? My kid would like to spend 24 hours a day playing video games with a gerbil feeder for sustenance so that they never have to get off the couch. If that's their goal, how do we treatment plan to their desires, but keep them safe and healthy and moving in the right direction? I guess that's probably a really good question. I mean, most teenagers would say, me, video games, we're like this, nothing else matters. Many of them would. So how do we treatment plan, so that we're not having our kid on the couch for the rest of their lives?
Yeah. I mean, this isn't just a problem for parents, it's a problem for clinicians, right? When I was actively seeing, when I had a caseload of young people that I was seeing every week, I had to be engaged in their culture a lot. Like, I had to understand what was going on. I had to know, I had to watch My Pretty Pony. I mean, I had to do a lot of stuff to really, and to understand the gaming culture. That had to be part of what I needed to understand so that I could relate to young people, right? I had to change my language. Like, heaven forbid you talk about smoking pot. Like they would roll their eyes, April. Smoking, that's what you say, smoking, right? And so,
And you're like, my bad, so sorry.
Exactly, because they're telling you what they want all the time. But you have to know how they're telling you. So this is where myself and the parents would sort of powwow to say, hey, what's going on at home? And here's what I think this is what this means. What are you seeing? Who are they hanging? We would talk and try to understand. And then sometimes I would just say, hey, I'm old, I'm stupid. What does this mean? And then they would tell me, and they'd say, this is when I would read Urban Dictionary a lot. It was like so pathetic. And they would tell me what it means and say, okay, with you, what does this mean? Help me understand, right? Because I want to know what you want and I want to know how you can make your life better, but I can't figure out what you're telling me.
Well, we actually asked my son, why do you enjoy video games so much? What is it? And after the superficial stuff of, fun graphics and whatever, we came up with, I know what to expect when I'm playing a video game. I know what the rules are. I know how it's going to function. I can start and stop at any time. Like I'm complete control of this universe. I can talk to people who we are all talking about the same thing, chatting online. And for us, they're not going to ask me a question that I don't know how to answer because it's going to be about the game.
Right.
So what he was really telling us was
Right.
that he didn't feel in control in his environment. And so we were able to look at it a little
Absolutely.
differently.
Exactly.
But when we look at how our strengths addressed, the CANS isn't all about needs. It's
Right.
also about strengths. And it's one of the few times we're actually asked what we're good at.
Yeah.
And how do you put that into planning? I mentioned earlier that when you're looking for services for your kid in the school,
Yeah.
it feels like all you're doing is telling them what is broken so that they can find a way to fix it. But when we're treatment planning, we don't, you don't expect to go into a room and go, look, I'm great at art. And let's join all the art classes. That's not what you're expecting because you could have joined an art class. How do we use those strengths?
Yeah. It's a really good question. And again,
feels awkward.
Yeah, it's really understanding what the strengths mean to your child, right? My son is not an artist, but he swam. He swam with a USA swim team since he was 6.
Wow.
And why did we get him involved in swimming? Because he's got ADD, and in swimming, you either focus or die. Right?
You sink, literally.
And he loved water since he was little. So it was a perfect way for him to start to be able to learn how to focus. And he was good at it. But it taught him so many other things, right? That he could help someone learn how to put their face under the water and blow bubbles. So it taught him. So he worked with the little kids and he was very patient with them, right? So understanding what strengths mean to your child is really important because you don't want to take a strength and ruin it for them, right? By linking it to something that brings them feelings of shame and feeling they're bad. So you have to be very careful how you link strengths in a treatment plan. So once you understand the meaning of the strength, then try to find a way to access that strength to help with a need, right? So when my son was feeling like, those weird phases of adolescence, and he was feeling like he didn't have an impact, it's like, he was still lifeguarding, he was teaching swimming, and I would ask him, so how many kids did you teach how to blow bubbles today, right? And he'd tell me, and I'm like, oh, how many kids actually learned how to do a little bit of a freestyle? And he would tell me, I said, oh, well, look, all those kids, you kept them from drowning today. How awesome is that, right? And so it's like knowing how to do that. And if you don't know how to do that, therapists can help you figure that out, right? That's their job.
It is. And I think it's also, sometimes using their strengths in a way that taps into something like, you really enjoy doing this. What if you did this here too? And it's not because I want you to hit a treatment goal, but why don't you use that thing over here and see, how you feel about it? Even just as a parent recognizing, like, I didn't realize that was a strength, or I didn't realize that that was an impact. It allows you to kind of say, I know you can do this because I see you do it here. And they go, I do? I'm like, yeah, you do it all the time and you don't even think about it because it comes naturally to you. So what if we use that over here? And I've been surprised actually that they're like, I didn't even recognize I did that.
Right. It's because when people are in a bad place, they forget about things that are going well. And so sometimes just a gentle nudge to remind them, hey, remember you do this, right? It helps them go, oh yeah, and it makes them feel empowered.
It does. Okay, so let's go on to the last question, and this is a doozy.
All right, so let's talk about how is the CANS updated, okay? So before we go into these questions, I want to give you a scenario. You can close your eyes or you can jot down some thoughts, but I just want you to listen. So think about a recent situation that happened at home with you or some member of your family. Just think about that situation for a second. And then pretend that your best friend who lives in another state calls you, okay? And you're like so relieved. You talk to your best friend about this situation in all its hairy, gory details. You just talk hour and a half. You just tell them everything. Your friend listens to you, empathizes, which is why you bothered to tell them anyway, because you knew they were going to do that. And they know you because you've shared yourself to them. So they talk through some ways that they know you can cope with this and work through this situation, right? So yay, you got to talk to your friend. A couple weeks later, your friend calls again and asks you about this situation. So what do? Do you go through all the gory, hairy details of the situation again and then give them an update? Or do you just give them an update on what changed and what different, what worked about your plan and what didn't? If the answer is the second, then you know how to do a CANS update. That's what you do. You don't have to tell your whole story again, right? That's why I said updates require you to work with someone who knows you. Because if it's not with someone who knows you, you're not doing an update, you're doing a new CANS.
Yep. All over again.
Right? So.
Well, and I think that, I just feel a lot better about updates just with that mental thing. And so people ask me, how long is it supposed to take to do an update? Well, I guess it depends on how much you have to report about what's changed. If things are going pretty good and this update is triggered because it's been a certain period of time and, things are chugging along about the same, then your update might be, what? Bobby's doing great in school. And, we've noticed that, anxiety is a little less in PE where we thought it was going to be a problem, but we're still watching it because we're not sure if we've hit stable yet. It still fluctuates a little bit. So we're still going to continue with what we're doing. But other than that, no changes. And your CANS update might be done. I mean, that might be all it is. I hope it is, because that's a nice and simple story. But it might be, oh my goodness, the family pet died, stuff hit the fan, a relative that we've never met before showed up on the front door and asked to move in. And the garage caught on fire and my husband was in a car accident. And oh my goodness, they changed, his teacher got sick and he has a permanent sub. And that's going to be a much longer conversation. So Amy, can you speak to the fact that when you have multiple kids doing this, their stories interact?
Oh, absolutely. They collide. And when one kid in the house is not doing well and in crisis, it affects other members of our family. And, that's what I like about the CANS is when it's done correctly, there's places for that. You can describe what's going on. A lot of times when kiddos start to digress in certain areas, with one of my kiddos, he has different times of the year that we know he always slides back. And in the beginning, when that was first happening, I remember, and this was more in an IEP meeting, so what stressors are in the home? Did anything change in the last few weeks? And then I share with them, and it had nothing to do with this child, but another one of my children in the home. And it may or may not have made a big impact on that child, but sometimes it can be a lot going on. And that's the nice thing when you have a provider that knows your family, is you can say, yes, so-and-so is doing pretty good, but these are the stressors in the home. And I think they're picking up on it, because oftentimes kids pick up on things that we just don't realize. And it may not be impacting them directly, but if mom's handling a crisis with another kiddo, mom's going to be on high alert. Mom being on high alert means she's going to be running more ragged. She's going to be more anxious. She's probably not sleeping. She's not making dinner on a regular basis. Like, there's a lot of things that plays, and the child may not understand what's going on and they can't verbalize it. But as a parent, because you do get that big picture and overall, view, that's where you need to, remind or let the provider know what else is going on that could possibly be affecting that child. And sometimes you have to do it in code. Luckily I have one kiddo who's developmentally delayed with a lower IQ. And so when he's sitting in those meetings, I find ways to be able to tell the provider, if it's asked during a session, yeah, we've got some big stuff going on at home, or take the time to talk to them privately, or, I love it. This is new to this area. I'm from North Idaho and we moved to Eastern Idaho. And one of the biggest things that I noticed was that the providers here give out their cell phone number. And so I was able to text providers and give them updates, before sessions. So they would know, hey, FYI, this is what's going on. Hey, so-and-so is doing really good in this area. Oh, hey, my family's in crisis because of this. And it's made collaboration a lot easier, and to keep everyone on the same page.
I laugh when you said that mom might not be cooking as much. I think my kids' cans would be noteworthy if mom started cooking on a regular basis. That would actually probably trigger a change in the cans. But no, it's not my favorite task to do. But I think one of the big questions is, so we do this update, we update in your example, we've updated our friend on what's happened since the last time we've talked. And my friend would be like, oh, well, that didn't work as we expected, or that seems to be working really well. Are you through that? Do you need something else? Or maybe we can tweak that. Or, wow, you just found something we didn't even know was going to work that well. How else can we use that? Like, wow,
Absolutely.
like that's really great. So I think the key is that it's a time for us to reevaluate our treatment planning. And it doesn't mean that every time you do a CANS, you throw all the treatment goals out the window, get brand new providers, new services, and no, probably a very bad idea. But it is a time to say, you know what? It used to be that service X was doing great, and my kid is bored out of their mind. But we have some other goals we could work on. Maybe it's time to, pivot.
Right. I remember I had a kid and a mom who were really struggling, and the mom called me one time and left a voicemail about something that went really well between them, and it was a lovely little voicemail. And so every time the mom came and was like, I want to give up, this is really too hard, I'm doing it wrong, I'd say, okay, wait, let's listen to this voicemail. Right? So the good updates are good, and it's really important to, remember them, highlight them, because oftentimes the updates are focused on the bad. So it's okay to share good things, no matter how big or small, because they're good things, right? And we need to have a documentation of those things as well. So that's just one thing I want to add. The other thing I want to say here is, as hard as it is, the CANS update includes you. If there's something going on with you that's making it hard or is impacting you, it could be you got sick, physically sick, or there's something else going on, that's part of the update too, because we want to support you too. So it's not just about your child, it's about you, it's about your family, because all of those things, as you know, interact together, and the update has to reflect what's going on with all of you.
And that means that sometimes the things you add to the treatment plan might be more respite or more opportunities to have, structure your evening for date nights, or maybe getting your own therapist. In fact, I would say most families who have kids with mental health concerns, having parents have their own separate therapy group is a good idea. There's something to be said about being able to walk into a safe place and say, and then this, and then this, and then this, and have that not jotted down in your kids' treatment records. Having that support is, to me, is really important. But I also think that feeling heard, like the check-in, that someone cares how we're doing now. It's not a set it and forget it treatment plan, at least for me. But then the question here is, does the entire treatment team get a copy of the update?
One would hope that the person that you're calling for the update, and you can remind them, do you mind sharing this with so and so and so and so and so and so, so that, because it's pretty major. Yeah, and me, because it's pretty major and we want to make sure everyone's on the same page.
And is the process really different than doing the original CANS? I think the answer is yes. Unless there was something so new that it opened old stuff and you need to go back and look at it. For example, I gave previously gave an example of bullying. There was a new trigger that we hadn't really, that was tied to an old event that we hadn't necessarily kind of got into. So that really was the big and hairy and scary we had to discuss in that update, stuff that we thought we'd finished. And so that would be the only thing that felt very similar, but it wasn't the whole beginning to end process. It was just this. And I would say that the therapist asked me some really good questions about other things that it might be impacting that I hadn't considered, that, the ooze of the event would ooze into other things. So I would say that felt more CANSy, if that's the way, than a regular update. But once that was explained, it went back to just telling how we are. So Amy, you have probably had more trouble with updates than I have. What would you say you have learned from this update process? Oh, there's laughing.
Be persistent. Sometimes it requires to file a formal complaint.
And only if it's not done right.
Only if it's not done at all.
If
it's not done right and you've talked with multiple people and you're still struggling with that process. There's times that CANS updates happen, and they don't happen on time. And there's other times like, oh, it's been a while. But if you have a good relationship with your provider, then it should go more smoothly. And I noticed that the providers I feel the most comfortable with, the CANS updates go pretty well. It's the ones that I don't know very well that it can be a struggle, or, when they try to send somebody that doesn't know us at all. But I do think it's important, and reminding people, in the state of Idaho, the CANS assessment is in a system called the ICANS. And so everyone should have access to that you've given a release of information to. And it can be definitely a struggle to get everyone to have access. And I don't know why there's still barriers, but sometimes as a parent, I choose to do the legwork to get people the information, which that might mean I go and I'm collecting all the information, then I'm distributing it. And that helps put the, further along the treatment plan or get the help that my child needs. It's a lot of work. It's not, I wish that it didn't have to be that way sometimes, but if you're already collecting the documentation yourself, then it's okay to do that. And then I would also say, just a side note in regards to record keeping and medical records in general, when you request records from an agency, they can only give you the records that they have created. So I learned this the hard way when we were trying to get my son into residential. This was 5 years ago. I had the rude awakening. I thought that I would just go to his last treatment facility or last provider, and they would have 10 years worth of records that each place, because every time I moved to a new place, I would say collect information, but that's not the way that it works. And so each provider has their own records. And like Dr. Fernando said, sometimes you're only going to get the CDA or the treatment plan. Most often you are not going to get the notes of the therapist. So then I realized, I thought there were years worth of documentation of all the things that had happened to my child. And that's just not the case. And so, with us switching over to the CANS, I believe that we can capture more and have more documentation, but it's always important as a parent to have your own documentation, and it can help things go more smoothly or quickly.
So Dr. Fernando, what would you like to leave us with that you want us to know as parents to help this be a little bit better, a little bit happier, a little bit more productive, whatever?
I just want you to remember that this is you. This is your story, right? This is you. You can use this to help advocate for things that your family needs, your child needs. They need your input, right? This is not about the providers making decisions on their own. This is about working with you so that you can get the best care that you need for your child and your family.
Well, I really appreciate this. I mean, as always, it's a pleasure to speak with you. It's a pleasure to have these questions answered. I think we did a pretty good job of going through the majority of questions that our parents ask us on a regular basis when they get a hold of the Parent Network. So we, as I mentioned before, we'll go ahead and we will post these videos so that people can use this repository of knowledge in the future. And I think I would like to leave that as parents are better educated on this system, that we model good behavior for our providers who don't know what we are expecting of them. When we are kind and gentle and prompt them, I have seen providers do amazing things once they realized what goal we were working towards together. And if that's what we're trying to do with our kids, then we need to have the grace to do it with our providers as well. We've asked them to change a lot with the implementation of youth empowerment services. And this is an opportunity for us to help create the system we want to see. So thank you so much everyone for joining us. And we're glad that we had you here. And for those of you who are sticking around, our last session of the conference is in just a couple of minutes, and I promise it will be fun. So have a wonderful, this was obviously fun. This will be silly. I'm going to go with silly. Next one's going to be silly. See you guys all later and have a wonderful day. Bye guys.